Dr. Konstantina Stankovic opens the discussion by highlighting the immense global burden of hearing loss, which currently affects approximately 1.5 billion people worldwide, with nearly 500 million experiencing disabling forms. The World Health Organization's projection that an additional billion people will face hearing loss by 2050 underscores the urgent need for increased awareness and effective prevention strategies. Hearing loss, often ignored or marginalized due to stigma, is unlike vision impairment. Whereas vision can often be restored or aided via glasses, hearing aids are only supportive and do not fully restore natural acoustic function. This contrast contributes to the underappreciation of auditory health, despite its profound influence on cognitive, emotional, and social well-being. The conversation stresses that hearing loss is multifaceted, with two broad categories: conductive hearing loss, which involves problems transmitting sound to the inner ear and often amendable via surgery or amplification, and sensorineural hearing loss, originating from damage within the inner ear itself. Much of the podcast's focus revolves around the inner ear and its sensory apparatus, emphasizing the delicate complexity of this tiny structure that is crucial for converting mechanical sound waves into electrical signals processed by the brain. Dr. Stankovic describes the cochlea, the snail-shaped auditory organ, as a marvel of biological engineering that fits on the face of a penny and operates with extraordinary sensitivity. Filled with mere microliters of fluid, the cochlea contains hair cells, sensory cells with microscopic stereocilia that transduce vibrational energy into neural impulses. The auditory system's ability to detect minuscule displacements on the scale of hydrogen atoms testifies to its exquisite precision. Outer hair cells play a unique role, actively moving at frequencies reaching 20,000 Hz in humans, thus amplifying sound signals with astonishing speed and accuracy. This sophisticated mechanism translates the frequency components of sound into positional encoding within the cochlea. High-frequency sounds stimulate the base, while low-frequency sounds travel to and activate the apex. The vulnerability of high-frequency regions to damage from noise exposure, ototoxic drugs, and aging contributes heavily to early hearing loss patterns observed in many individuals. The interconnectedness of the hearing organ with the vestibular system, responsible for balance, and its embedding in the densest skull bone further illustrate the inner ear's complex and protected environment. The podcast delves into the journey of sound waves from their propagation through the environment to their mechanical effects on the eardrum and inner ear fluids. The tympanic membrane vibrates in response to sound pressure, activating the ossicular chain, the hammer, anvil, and stirrup bones, which in turn stimulates fluid movement within the cochlea. These mechanical vibrations translate into electrical signals via mechano-electrical transduction. Dr. Stankovic explains how different sound frequencies modulate vibrations in distinct cochlear regions, describing the place frequency map that underpins both speech processing and music perception. The subtle orchestration of frequency coding facilitates the human brain's unparalleled capacity to discern complex auditory scenes, enabling speech recognition even amid background noise, a phenomenon underlying the famous cocktail party effect. Hearing loss emerges from multiple etiologies, including genetic mutations with over 200 genes implicated, infections like cytomegalovirus, noise exposure, aging, autoimmune disease, and certain medications. Diagnosing the specific cause or subtype, particularly for sensorineural hearing loss, remains challenging because of the organ's microscopic size and inaccessibility to direct biopsy or imaging that could reveal cellular detail. Dr. Stankovic outlines the limitations of conventional audiograms, which may fail to detect hidden hearing loss, where synaptic connections between hair cells and auditory nerve fibers are damaged, yet thresholds remain normal. This underscores the emerging need for more sensitive diagnostic tools, including advanced imaging techniques and molecular liquid biopsies of inner ear fluids during surgery, aiming to refine personalized treatment approaches in the future. An important section addresses the pervasive modern risk of noise-induced hearing loss exacerbated by loud music, urban soundscapes, and recreational headphone use. Dr. Stankovic emphasizes that safe listening time halves with every 3 dB increase over 80 dB, pointing to the danger of common experiences such as concerts, motorcycle rides, and even airplane cabin noise. The concept of two-hit damage models illustrates how sequential or cumulative exposures can have synergistic, irreversible effects on hearing. Protective strategies highlight the benefit of using correctly fitting earplugs with appropriate sound attenuation during noisy events. Magnesium supplementation before noise exposure also shows promise in reducing cochlear damage, supported by military studies where individuals receiving magnesium had less hearing loss following artillery noise. However, she stresses that while supplementation can be helpful, a nutrient-rich diet high in leafy greens, fish, and nuts remains the foundation of auditory health. Tinnitus, described as a brain-generated phantom auditory perception arising from reduced peripheral input, affects many millions and varies widely in severity. The underlying neural mechanisms involve changes in auditory pathways and related limbic circuits that modulate emotional responses. Despite its prevalence, effective treatments are limited. Cognitive behavioral therapy and hearing aids represent the two evidence-supported management approaches today. The podcast underlines the paradox whereby attention to tinnitus worsens the symptom due to reinforcement of neural circuits. Thus, distraction and psychological reframing are critical advice for sufferers. Dr. Stankovic notes that no supplement, including magnesium or melatonin, has reliably demonstrated a direct effect on tinnitus itself, although magnesium is beneficial for related migraine conditions. She underscores the importance of thorough clinical evaluation to exclude rare but serious underlying causes, such as acoustic tumors, ensuring proper characterization and personalized treatment. The auditory system demonstrates remarkable plasticity throughout life, enabling adaptation to new sounds, languages, and musical experiences. Musical training and engagement can enhance auditory processing and cognitive skills, evidenced by better outcomes after cochlear implantation in musicians. Training the brain to distinguish complex auditory stimuli often improves resilience to deficits caused by hearing loss. Dr. Stankovic expresses enthusiasm about how enriched auditory environments and auditory training may augment brain plasticity beyond hearing threshold recovery, potentially benefiting cognitive and social function. Such enrichment aligns with evolutionary evidence linking music and language development to human social cohesion, communication, and emotional well-being. Expanding on a major public health implication, the podcast explores the epidemiological association between hearing impairment and dementia risk. While not deterministic, reduced auditory input correlates with social isolation, depression, and cognitive decline. The mechanisms likely involve both direct neural changes and indirect effects from decreased social engagement and cognitive stimulation. Dr. Stankovic highlights the inadequacy of traditional hearing tests to identify early risk and emphasizes newer speech and noise tests as better predictors of functional hearing loss contributing to cognitive challenges. Protecting hearing through lifestyle modifications, early intervention, and emerging therapies thus emerges as a critical strategy to maintain brain health with aging. Not all individuals experience hearing loss equally given similar sound exposures, reflecting genetic predispositions in vulnerability, sometimes analogized to tough versus tender ears. Additionally, women generally retain better hearing sensitivity premenopausally, likely influenced by estrogen's protective effects. Postmenopausal hearing decline may relate to hormonal changes, suggesting a potential avenue for future therapeutic investigation. Environmental factors include widespread exposure to ototoxic agents such as certain antibiotics, chemotherapy drugs, NSAIDs, heavy metals like lead and mercury, and emerging concerns about micro and nanoplastics preferentially taken up by auditory hair cells. This toxicological insight underscores the growing importance of reducing chemical exposures and pursuing research on environmental hearing threats. Technological innovation dramatically transforms the auditory health landscape. Cochlear implants, now routine outpatient procedures covered by insurance, stimulate auditory nerve fibers directly and have restored hearing to hundreds of thousands worldwide. Despite their remarkable success as the most widely used neuroprosthesis, implantation requires post-surgical auditory training, and outcomes are shaped by prior musical experience and neuroplasticity. Modern hearing aids benefit from artificial intelligence, enabling real-time auditory scene analysis to separate speech from background noise and reduce feedback, improving comprehension, especially in complex environments. Such personalized devices reflect the future of hearing care, though challenges remain in balancing directional amplification with natural awareness of surrounding sounds. The podcast situates the auditory system alongside the vestibular apparatus, both housed in the inner ear and evolving from common mechanoreceptive origins. While the cochlea specializes in high-frequency vibration detection, the vestibular organs sense lower-frequency acceleration and play crucial roles in balance and spatial orientation. Disorders such as superior semicircular canal dehiscence illustrate how aberrations in this system can produce debilitating auditory and vestibular symptoms, including perception of internal bodily sounds and vertigo. Dr. Stankovic also touches on the vast influence of auditory perception on psychological states, emotional processing, and social interactions, making clear that hearing is more than a sensory modality. It is intricately linked to quality of life. The impact of noise and sensory pollution extends beyond the individual to ecological domains, illustrated by sound disturbances harming sea mammals, communication, and navigation, emphasizing the broader significance of auditory health at environmental and species levels. Throughout the conversation, Dr. Stankovic frames hearing not merely as a peripheral sense, but as a foundational pillar for cognition, social connection, and emotional life. From prenatal auditory experiences shaping the developing brain to age-related sensory decline influencing dementia trajectories, hearing health is intimately tied to human flourishing. With advances in diagnostics, protective strategies, therapies, and technology, greater emphasis on auditory care promises profound benefits. The dialogue closes by encouraging proactive behaviors, monitoring sound levels, using ear protection, maintaining good nutrition, and seeking clinical evaluation when needed, while acknowledging ongoing research promises to sharpen diagnosis and expand treatment options. Preserving and enhancing hearing, Dr. Stankovic underscores, is essential not only for protecting our ability to communicate and enjoy music, but for safeguarding brain health, mental well-being, and quality of life across the lifespan.